Colorectal cancer. Colorectal cancer is a malignant tumor arising from the inner wall of the large intestine, colon, or the rectum. And risk factors for this is the first is the diet. The high content of a meat in the diet or reduction of fiber and animal fat accelerates the growth of the intestinal bacteria that produce cancerogens. The next factor is genetic factors. The possibility of hereditary transmission proves the presence of the family polyposis syndromes and increase in the risk of the developing of cancer. And the next is previous pathology, for example, Crohn's disease, cancer, history of cancer, polyposis syndrome, epithelial tumors, or immunodeficiency. The other risk factors are the presence of the chronic colitis, hypertension and intestinal atony, injury to the mucosa in the places of physiological constrictions, and the frequency among the production workers in sawmills. And here you can see the ways of the metastasis, ways of the outflow of the lymph. And the macroscopic forms of the colorectal cancer are, the first one is exophytic, tumor growing in the lumen of the intestine. The next one is saucerous, swollen oval in shape with raised edges and a flat bottom. Endophytic, tumors that infiltrate the wall of the intestine that don't have clear boundaries. By histological pictures, they can be adenocarcinomas, mucous cancer, solid cancer, squamous cell carcinoma, and glandular squamous cell carcinoma. Clinical classification. The first stage, a small tumor localized in the thickness of the mucous and submucous layer. The second A stage, a tumor of a large size but don't occupy more than a semicircle of the wall. Second B stage is a tumor of the same or smaller size with a single metastasis. Third A stage, the tumor occupies more than semicircle of the intestine, its entire wall or neighboring peritoneum grows, and there is no metastasis. Third B stage, a tumor of any size, but in the presence of multiple regional metastases. And the last fourth stage, an extensive tumor that sprouted neighboring organs with multiple regional metastases. And here you can see TNM classification, tumor, nodal, and metastasis. Clinical picture. Symptoms of the cancer of the right half of the colon are pain, anemia, loss of appetite, and general weakness. Pain occurs in 90% of the patients. It has a dull character, not very intense, constant pain due to the inflammatory process. Anemia is observed in 65–70% of the patients. Weight loss in colon cancer is rare. Symptoms of the cancer of the left half of the colon come to the fore for the difficulty of the passage of the decorated feces through the intestines. Relatively rarely, constipation alternates with diarrhea. Hematogenous metastasis of the tumor usually affect the liver, possible lesions of the bones, lung, and brains. And diagnostics. Irrigoscopy. Contrast study of the colon with barium allows you, the first, to detect the presence or absence of a tumor, determine the shape of the tumor, judge the extent of the tumor, and identify anatomical and functional intestinal features. The next is endoscopy with biopsy. It could be a sigmoidoscopy or colonoscopy. These studies make it possible to determine the state of the mucosa of the entire large intestine, the localization and type of the tumor formation. Here you can see a picture. Also, growth of the tumor. This endoscopical removal of a villous colon tumor. And also diagnostics includes CT, ultrasound, or liver scintigraphy is performed to exclude frequently occurring distant metastasis. And laparoscopy is indicated to exclude the generalization of the malignant process. Test for the occult blood in patients with a high risk in the stool should be performed and carefully examined for unexplained blood loss. And the differential diagnosis should be provided with intestinal tuberculosis, appendicular infiltrate, bowel actinomycosal, intestinal obstruction, inflammatory diseases of the colon, tumors and ovarian cysts, non-epithelial benign and malignant colon tumors, polyposis, diverticulosis of the colon, tumors and cysts of the kidneys, nephroptosis. And the treatment includes surgical treatment, different types of operations. Chemotherapy is used after radical surgery in patients with common forms or in inoperable patients or those who refused surgery. Radiation therapy is not applicable, but radiation therapy is used only for colorectal cancer or as an option for palliative treatment for distant metastasis. In prevention and treatment of tumor recurrence. After the radical treatment, a medical examination should be provided in the first year once every 3 months, on the second year 1 time every 6 months, and starting from the third year once a year. During the examination, we should provide ultrasound scan, irrigoscopy, and the colonoscopy, MRI and CT as examinations according to the indications.